Welcome to COPcast. I'm Rumbi Chakamba, Associate Editor at Devex, and I've headed to Sharm el-Sheikh in Egypt for this year's United Nations Climate Conference. In this podcast series, we bring you inside the walls of the Blue Zone for a series of in-depth conversations with climate and development leaders, asking them the big questions. What's really needed to make meaningful progress towards climate goals, and what role should the development community play to support that?
Without question, this is a health emergency. The question is, how do we get people to care about that health emergency?
Ahead of COP27, Tedros Adhanom Ghebreyesus, WHO Director General, issued a stark reminder for global leaders. Climate change is making millions of people sick or more vulnerable to disease all over the world. And it is crucial that leaders and decision makers come together at COP27 to put health at the heart of the negotiations. Although there is a WHO pavilion, health does not feature on the official COP agenda. Devex's senior reporter, Sara Jerving, sat down with Vanessa Kerry, founder of the non-profit Seed Global Health, to talk about the urgent need to formally include health in the COP proceedings.
Thanks so much for joining us, Vanessa.
I'm delighted to be here.
So Seed Global Health has a focus on training doctors, nurses, and midwives globally. Can you tell us a bit about why you're here at COP27?
Absolutely. I'm here at COP27 to advocate strongly for the importance of focusing on climate change as a need to address major health issues that are happening in the world. About 23% of the world's burden of disease is actually related to climate, some kind of climate-related event. And when we think about our human sustainability and well-being, our health and well-being, our climate, and the resources we have to sustain ourselves are deeply interlinked. And so I'm here to help draw attention to that and to hopefully help propel some of the actions around climate change, and to have folks realize that investments in our climate change can also be strong investments in our health systems and a win-win.
So health is not officially on the agenda at COP. Why is that, and kind of what are you doing to change that?
Well, it's interesting because I would say health it's not officially on the agenda of COP, but it's 100% the agenda of COP in many ways because of the rise in burdens of disease that we are seeing from extreme heat, from air pollution. Cardiovascular diseases are going up. There's already 29 new outbreaks of cholera this year alone, which is way above what we usually see, and all this is related to climate change. So all the discussions we are having here today actually relate to human health and how we are going to protect that. We would like it to be officially, though, on an agenda, and we are petitioning to try to see a formal agenda around the intersection of health and climate change at next year's COP in the UAE and onwards, because at the end of the day, that really tight sort of interlink between health and climate is also about security, it's about economic growth, it's about gender equality. It relates to all of these key issues for our well-being.
And what would be the significance of having it officially on the agenda at next year's COP? Kind of what could that do to further drive an emphasis around health, the intersection of health and climate?
I think, anytime things are formally recognized, there's an opportunity, I think, to much more strongly propose solutions and to build the collaborations and the attention and resources that are needed to actually solve a problem. And so just to give an example, Seed Global Health trains health workforce, which is critically important to the adaptation of climate change, with the additional 250,000 deaths that are going to come from climate change. We need a workforce to address that. And so to be able to build out that workforce, you need sort of money and time and attention. And so by putting something formally on the agenda, you can start to mobilize the resources that are needed to help mount that response and to build out that frontline emergency response for a country like Uganda, where over half the deaths are from a failure of emergency and triage services, and a lot of that is related to climate-related events. And so I think when it becomes formal, you also have the opportunity to engage other sectors. And so this is a multi-sector problem. Health does, if there is an additional, for every dollar invested in health, you can get $2 to $4 out in returns economically. 7% increase in GDP, or 4.4 trillion by 2040 if we start to invest in people's health. So that's got a multi-sector reach. So we have to engage multiple sectors in these solutions. And the formal agenda really allows that opportunity.
And so, in what buckets of discussion would health fit under? Does it have relevance in both adaptation and loss and damage? And kind of, you alluded to kind of these investments in the workforce. Kind of, what do you see as smart investments in the adaptation or loss and damage space?
So, without question, it's both. I mean, I think at the end of the day, the rise of greenhouse gases and that impact is a direct impact on health. And most people around the world, their main asset is their ability to do labor and to work and to earn their living. And so when you are directly impacted, you cannot go to work from chronic pulmonary disease or a heart attack or something else. That is a very direct loss that is impacted by health. So the adaptation is our ability to focus on prevention, public health measures, and to be able to have a workforce that can actually address these increased burdens of disease. That is win-win too. We just came out of a pandemic of COVID that was arguably we are still in, and the loss of COVID was tremendous. What COVID helped illustrate for us, though, is that primacy of health into everything that we're trying to do. And so, we also, what it did was it highlighted the fact that we don't have our healthcare workforce, for example, needed to address that COVID. And what we found in SEED is, we've trained almost 40,000 healthcare workers in 7 countries over the last 10 years. Those healthcare workers might be delivering a baby one day, but then they were diagnosing the COVID another day with a handheld ultrasound and helping to respond to that. They are then helping to treat cholera as it hits in Malawi. So the flexibility to address all of these diseases that we see in climate change through workforce is critical. That is it's one of the key things that we are trying to push for. Our ability to reduce our greenhouse gases is a win-win, because not only is it going to protect our environment and save our oceans and ensure that we have less, storms and floods, but it is also going to be a protection to our health and well-being, which has that positive feedback loop to everything else.
So one of the issues with climate change is kind of the intersection of humans and wildlife. And as resources become more strained, people have greater impact with wildlife. And so I was listening to the Global Health Summit recently, and the head of the WHO Regional Africa office said that was one of the problems with the Ebola outbreak in Uganda right now, is that the outbreak was able to spread because there was not adequate workforce in that area. Could you talk a bit about resource gaps in the health workforce and how that is linked to climate in that sense too for new outbreaks?
So there is a global critical shortage of healthcare workforce today that is slated to grow by 2030 if we don't do anything about it. This was exacerbated even further by the COVID pandemic, which cost, as of November of last year, 180,000 healthcare workers, and likely far more than that since the pandemic has continued. And so what you're seeing is that some countries will have only 3 doctors for every 100,000 people, versus where I live, it's somewhere more in the 240s. And so the numbers the ability to care for a population is diminished, but it also means the ability to detect pandemics is diminished. And if you look at a country like Liberia or West Africa, which had a terrible Ebola outbreak in 2014, 2015, and this relates a little bit to what we see in Uganda, a single toddler who had Ebola crossed a border into another country. The symptoms weren't recognized because there wasn't enough workforce that had been trained in this. That toddler went on to be the spark that ignited a global outbreak that affected over 26,000 people, killed over 11,000, and affected over 6 countries, and was a $53 trillion downturn. And that really relates because there wasn't enough healthcare workforce to recognize what was happening, to sound the alarm, and to be able to ask for the help and to mount that help. Everybody said never again, lesson learned after that outbreak, and millions was poured into the region to help do preparedness and surveillance. And uncoupled to sustained investment and to really building out that sustained investment needed for workforce, Liberia, as an example country now, is among the 70 countries least prepared for a pandemic outbreak, and yet this is the one that should be the most learned. There's incredible knowledge, but the infrastructure isn't there in full because the investments weren't supported. You need to make sustained and long-term investments over time to be able to really build out that resilience in the network. And so Liberia, for example, is a country that now is among the least prepared because that full panel of infrastructure wasn't sustained. There was initial investments for a couple of years, and then they said, go off and do it alone. But these are countries whose GDPs are just too low. Even if they are already dedicating a significant percentage of their GDP to health, you're still asking people to deliver healthcare for a cup of coffee. And that's not going to work. Yet, if we build out these resilient and full workforces, you will have the surveillance needed to be able to protect populations, to be trained to identify these outbreaks, even in the most remote settings, and to respond immediately. For example, actually in Uganda, where they have made investments in healthcare workforce, and where they have a mortality rate of Ebola now that is about 40%, which is unheard of in sub-Saharan Africa prior to this, for this particular strain that doesn't have a vaccine. Without question, Uganda had faced challenges in the rural areas because there's not enough healthcare workforce to help identify, and that did allow for some of the initial spread of Ebola as it happened. But Uganda has experienced Ebola before, as they were very proactive and they started to identify the cases and do the contact tracing and bring the cases to places where there was a deeper density of healthcare workforce, and applied that workforce and the knowledge to treat Ebola. They've been able to help show a much different and lower mortality rate than you've seen traditionally in Ebola outbreaks where there's not a vaccine in the past. And so going, from historic mortality rates of 90% down to closer to 40% really speaks to what's possible when you have a workforce available to treat. You need enough of that though. So, you could have stopped that in its tracks within the rural districts if you'd had enough of a workforce available. And the aspirations are there for these countries, but they need the help and support to be able to make those investments and to see that plan out in full. The healthcare workforce is the backbone of a health system. Healthcare is a human-centered intervention. And it is not going to get solved by technology. It is not going to get solved solely by telemedicine. Those are bridges. We need people to lay hands on a patient, to change a bandage, to be able to, even if you're going to die, to let you die with dignity. And I think that we cannot forget that in this day and age. And so the workforce for me is a tide that lifts all boats, because it is job creation, it is gender equity, where 70% of jobs are women, it is our climate adaptation, it is our ability to respond to the diseases that are, preventing countries from growing and thriving and having economic growth. It's security. It'll stem migration if we can have systems that are responsive to their population. And so I think we have a choice right now to make, and it is to either invest in our long-term resilience and human sustainability, or to continue going the way we have been, which is only becoming more and more divided, more and more troublesome, and frankly is just not sustainable.
Climate change has been named the biggest threat facing humanity by the World Health Organization. Yet too often, climate change and global health are treated as separate, unrelated issues. In a new series from Devex, we explore the impacts of the climate crisis on human health around the world, and how a planetary health perspective can help provide solutions. Search for Devex Planet Health to find out more.
One of the challenges that we saw during the COVID-19 pandemic was that because it is a new disease, the information was rapidly evolving, and so there was a challenge around training the health force on the new updates of treating patients and whatnot. And that is relevant to the climate discussion as well, because diseases are taking new form and increasing in certain areas that they weren't present before. How do you how do you continually train the health workforce in a changing world?
Well, I think at the end of the day, healthcare is a life journey of lifelong learning. We are taught in training to be lifelong learners, and there's always going to be new science, and there's always going to be new evolution, so there should be, because it empowers us to get better at our job. I do think this is an example where technology can be leveraging. If you have the people able to provide care, you can use technology to help update them, and we've had some robust partnerships where we've been able to use technology, digital systems, remote learning to be able to augment people's understanding of best practices. It has to be coupled to in-person though, because at the end of the day, you can draw on chalkboard how to manage high blood pressure, but it's still very different when you see a patient who might not quite be on that perfect bell curve of what a patient with high blood pressure looks like. And so learning through experience is very important. But I think that we're very lucky that we partner directly with the ministries as well, so we can get to scale quickly when we have the interventions to be able to share. But I think, SEED's job is to bring those best practices to our partners and to work together to put those best practices, into place. And it's really a dual partnership with those that we're in service to. And we identify together what is the information needed and work together to bring that training out. But we'll do it in any number of ways, at the bedside, through technology, through sharing updates and best practices, but and using our partners at the ministry and elsewhere to help scale that quickly.
So earlier this morning, we walked past your father, John Kerry, who's engaging in these discussions as the U.S. presidential envoy for climate change. Has your father's global role on this issue influenced your work on climate?
I grew up in a house of public service. Both my parents were public servants in very different ways, and I think that influence has been a part of my life since the day I was born. We are global citizens, and we have a responsibility to be a part of being in service to those around us. My father has been a climate champion since before I was born, and I grew up going to Earth Day as a child and have been very aware of this incredibly precious resource that we have. And it's funny, it's anything from being, when I was little, what felt like being dragged, to walks in the woods to just listen and appreciate and understand. And then as I've gotten older, it's been through the really severe understanding, through really real conversations that happen at the dinner table, the severe, risks that we face, and really the urgency of this moment. So I learned from it. I'm deeply privileged to be able to, have that, resource to draw on in many ways. But it's also, I think that I will have enough, hubris to say also I think I'm teaching him about the ways that health has been really front and center in these climate discussions. And so I think it's a huge influence for me, but I think it's also a torch that I carry very much on my own at this point in terms of the implications of what it means for our human health and what we are up against if we, don't do something about this. And we're talking about the most sort of fundamental issues of our human sustainability and future is the climate that we draw on for all of our resources and to live, and the health that we need to be able to walk outside our front door, to care for our families, and to go to work. And those are deeply, deeply interlinked. And so it's a privilege to be able to learn from him, and I hope I'm contributing in the way that supports him too.
And I'm not sure that everyone considers climate change a health emergency. Would you agree with that, and kind of how do we change that narrative?
I think a lot of people don't consider climate a health emergency, and I think we are running an uphill battle because a lot of people don't see health actually essential to their daily lives, right? You do when you lose a family member to cancer. You do when somebody has a heart attack. It hits you full on, and suddenly when health is personal, you value health. When health is theoretical because you were young and healthy, or it doesn't impact you as much, or you're more worried about your economic bottom line, it's sometimes hard to make that link between health and your personal daily life. But the reality is there's tons of data that say that when you fall ill, your household is more likely to suffer catastrophic costs that will put you below the poverty line. We see that in cancer, 50% of households, in non-communicable disease like heart disease, 25% of households. We know very directly that we can see this on a larger macroeconomic level as well. But the health emergency is just the amount of outbreaks and pandemics is way up. We have direct health emergencies from extreme heat, which causes premature births. We have health emergencies in terms of the climate change and the storms and the monsoons and the flooding. I mean, there are millions still completely displaced in Pakistan. And there's an expected internal migration of 216 million people from climate change that is expected in the future. And when you look at those numbers, you're losing access to your resources, to health, to your well-being. And so without question, this is a health emergency. The question is, how do we get people to care about that health emergency in the frame of losing your housing or losing something else and having that be the top priority. And I think, realizing the coexistence of these issues is one and the same. The solutions also become one and the same in many ways as well. But I think people have to realize that we are up against one of the major challenges of our time. And those health burdens are going to cost us money, they're going to cost us lives, they're going to cost us economic growth, they're going to fuel migration. So this health emergency in and of itself is about the burden of healthcare that we're going to seek and the suffering we will endure. But it's going to have ramifications across every other sector too. So it is a very driving force, I think, within the conversations we're having today, and hopefully will be front and center on a formal agenda next year at COP28.
Is there anything else that you wanted to add?
I think just, it's going to sound a little bit corny, but we have a really real moment in time that is, we have to sort of grasp and really drastically change. We cannot go back to what we were doing before with just marginal improvements. We have to seismically shift how we live, what we prioritize, and how we're going to carry this moment forward. And that's incumbent on all of us, every single listener, in their individual behavior change and in what they demand from their policymakers. So we all have to be global citizens, and I just ask people to be a part of that movement for change, because you can't do it here just among the hundreds of thousands that are here, or the tens of thousands that are here at COP. It's got to have a complete, wave of momentum that leaves from here and changes all our behavior.
Thank you so much for joining us, Vanessa.
Thank you so much.
Thanks for listening to COPcast. We'll be publishing episodes every day throughout COP27. So make sure to subscribe on your favorite podcast streaming platform. And if you've enjoyed today's episode, please share it with others you think would be interested in it. You can also leave us a rating or a review on Apple Podcasts. If you have some feedback about this episode that you want to share, or are at COP and want to let us know what we should be covering, would love to hear from you. You can find us on social media at Devex and at rumbichakamba_, or you can drop us an email at podcast@devex.com.